Good afternoon. Thank you for joining us today. I'm joined today by the Economy Secretary, Fiona Hyslop, and our National Clinical Director, Jason Leitch. Let me start, as always, with an update on some of the key statistics in relation to COVID-19. As at 9 o'clock this morning, there have been 15,709 positive cases confirmed through our NHS laboratories, and that is an increase of 27 from yesterday. A total of 914 patients are in hospital with confirmed or suspected COVID-19. That represents an increase of 5 overall from yesterday. However, the number of confirmed cases within that has reduced by 20. A total of 23 people last night were in intensive care with confirmed or suspected COVID-19, and that is an increase of 2 since yesterday. I'm also able to confirm that since the 5th of March, a total of 3,873 patients who had tested positive and needed hospital treatment have since been able to leave hospital, and I wish all of them well. In the last 24 hours, 3 deaths were registered of patients confirmed through a test as having the virus. That takes the total number of deaths in Scotland under that measurement to 2,442. Now, even as we see these figures decline, thankfully so, it is nevertheless really important that we don't lose sight of the fact that they are not just statistics. They all represent unique, loved individuals whose loss is a source of grief to many people. So once again, my condolences are with everyone who has lost a loved one to this illness. And I will also express again my thanks to our health and care workers. Your efforts are enormously appreciated, and again, even as we see numbers in hospital and intensive care reducing, we know you are still working incredibly hard in difficult circumstances, and you have our deep gratitude for that. There are 2 items I want to update on today. The first relates, of course, to the economy. Today's GDP figures show that in April, the UK economy contracted by more than 20%. That is by some distance the largest decline on record, and it confirms the scale of the economic crisis that has inevitably been caused by the health crisis that we face. I have previously welcomed the UK Government's interventions, especially the furlough scheme, which has helped to preserve jobs during this period. But in my view, it is now time to signal a further extension of Treasury support. Other countries have already made this move, including France, where plans are being put in place for a long-term partial activity scheme covering possibly as long as the next 2 years. The alternative to extended support being put in place is either that businesses are forced to reopen before it is safe to do so, and that of course could damage health and it could cost lives, or businesses have to take an even bigger hit and that will cost jobs. In my view, neither of those alternatives is acceptable, so I hope we will see further action from the UK Government, and we look forward to working constructively with them, playing our full part in making all of that happen. The fall in GDP is obviously something we discussed at this morning's weekly meeting of the Scottish Cabinet's Economic Subcommittee. We also looked ahead to the publication of the latest statistics on Scotland's labour market next Tuesday. Those figures will cover February to April of this year, so that's a period which obviously includes the first full month of lockdown. Now, I don't want to preempt that publication, I'm not able to preempt it, but we do expect to see a significant impact on employment and a rise in unemployment. And sadly, despite all of our best efforts, that situation is likely to remain challenging in the period ahead. And of course, all of that is before we factor in any potential impact on the economy from Brexit. And that's why I have today joined with the First Minister of Wales in writing to the UK Government calling for an extended Brexit transition period to take away the risk of a no-deal outcome, and also to make sure that all of us remain focused on supporting business through the post-COVID recovery and not making the challenges that the economy and our businesses face any worse than it already is. So that's the action I believe we need from the UK, but I am acutely aware of the responsibility I have as First Minister and the Scottish Government has to make sure we are doing everything within our power and resources. And that's relevant to the announcement I'm making today, because we are incredibly focused on making sure we are taking action to protect jobs and hopefully in the future to create jobs as we lead our economy through the post-COVID recovery. The impact of this crisis is, of course, felt across our whole economy. I had discussions yesterday with the tourism sector, a sector particularly hard hit. And we know there are other sectors that are particularly badly affected too. For example, Scotland's energy sector is facing a massive decline in global demand, and that is having a very serious impact on our economy. The Scottish Government wants to do everything we can to support the energy sector through this crisis. We want to protect jobs and businesses in the northeast of Scotland and across the country. And in doing that, we want to make sure that the sector is able to continue to lead and indeed to benefit from Scotland's necessary transition to a net zero economy. That's why today I'm announcing a new £62 million energy transition fund. Over the next 5 years, that fund will support key energy projects which will help Scotland's move to net zero. For example, one project, the Global Underwater Hub, brings together engineering expertise from academia and industry, and it will help our oil and gas sector use its existing subsea and underwater expertise in new areas such as marine renewables. Another project receiving support will be the Energy Transition Zone, a new business park adjacent to the Aberdeen South Harbour. That will provide state-of-the-art facilities for the manufacture and development of renewable and low-carbon technologies. Almost inevitably, given the focus of the fund is the transition from oil and gas to renewables, the projects which directly benefit from this fund are currently based in the northeast of Scotland. But by securing Scotland's place as a world leader in key technologies for the future, they will help businesses right across the country to diversify, to attract new investment, seize new opportunities, and both protect and create jobs. We know that the energy transition will shape our country's economic future. That was true before the COVID crisis, and it remains true during and after the COVID crisis. But through these investments, not only will we shape that energy future and economic future, we will also help with the economic recovery from the crisis that is currently afflicting so many businesses across Scotland. Now, the second issue I want to touch on today concerns the Scottish Government's approach to easing restrictions. As I'm sure many of you know and will be eagerly anticipating, the current restrictions will be reviewed again on Thursday next week. Our considerations will be informed, as they will always be, by the scientific evidence and advice and the clear principles we have set out. However, I have been acutely aware throughout this crisis that it is not and never will be enough for me simply to tell you what I want you to do. I also have a duty to explain to you on an ongoing basis the reasons behind what we are asking you to do. In fact, the reason that I conduct these press briefings on a daily basis is to ensure that you get clear and direct information on the impact of COVID-19 and on the country's response. That's vital to ensuring that people understand the threat that the virus poses, but also how we can all work together to reduce and mitigate that threat. Now, I've spoken before about some of the research we undertake to check that the messages we're trying to convey are getting across. We're going to publish the latest research today so that you are able, if you're interested, to read it for yourself. It shows, amongst other things, that the vast majority of people in Scotland continue to support a careful and gradual easing of the restrictions. But the aspect of the research I wanted to particularly highlight today is around public attitudes to our new test and protect system. The research shows that 90% of people say that they would be willing to isolate for 14 days if someone they had come into contact with had symptoms of the virus. 90% say they would be willing to undergo coronavirus testing if asked to do this, and 88% are happy to provide details of people they've been in contact with if they develop coronavirus symptoms. Now, that's important, and it's also really encouraging because, as I've said to you before, Test and Protect is going to be a vital tool in keeping the virus suppressed as we ease more restrictions. But Test and Protect can only work if all of us across the country are willing to comply with the measures that it sets out. If we're willing to get tested when we have symptoms if we're willing to isolate if we have the virus, and if we're willing to self-isolate if we've been a close contact of someone with the virus. So these research findings showing that willingness to make personal sacrifices for the common good are really encouraging, and I want to thank everybody for that spirit of collective endeavour that I think we all still have. Now, I want to conclude today with a key point about the critical juncture that we are at in fighting this virus. I know that as cases, hospitalisations, numbers in intensive care, deaths and the R number all decline, many will think that that means we should speed up our exit from lockdown. And I understand that. We are all deeply, deeply anxious about the impact on the economy. But the fact is this, the reason we are making such good progress now is that we are carefully following a plan. And if we depart from that plan, we will risk the progress we're making. On the other hand, if we're prepared to stick with the plan, I believe we will keep making further progress. And the more we suppress this virus, the more lives will be saved and the fewer people will suffer the long-term health consequences that increasingly we fear that it might leave some people with. But also, if we suppress this virus sufficiently, we will be able to restore a greater degree of normality to all of our lives. So while I understand the desire for speed of recovery, the sustainability of our recovery also really matters. The simple fact is, if we go too fast now, we risk a resurgence of the virus that will then set us back. And that is a risk, in my view, we must be careful not to take. So I very much hope that we can and will take more steps forward at next week's review. But I want to be very clear that we must continue to do that carefully and cautiously. And if we do, we will continue to suppress this virus, and it will mean that we get back to more normality than we will otherwise do. And all of you can help us in moving in the right direction with sticking with the rules. So as we head into the weekend, I want to briefly reiterate again the key public health guidance that is in place for now. We should all still be staying at home most of the time and meeting fewer people than normal. If your life feels like it is getting back to normal, think about whether you're complying with the guidance as you should be. When you meet people from another household, you must stay outdoors and you must stay 2 metres apart from them. Don't meet up with more than one household at a time. Don't meet up with more than one a day. And please keep to a maximum of 8 people in a group. Wash your hands often. Wear a face covering when you are in a shop or public transport or any enclosed space where it is more difficult to physically distance. Avoid touching hard surfaces and clean those that you do touch. And as I have said already, if you have symptoms of COVID-19, ask for a test immediately. Go to the NHS Inform website and follow the advice on self-isolation. Above all else, we all have to remember that we are still in a situation where our actions as individuals have an impact on the health and well-being of everybody. So I want to end again today by thanking you sincerely for your patience, for your forbearance, and for making the sacrifices you are making so that collectively as a country we continue to get through this crisis. My thanks to all of you, and I will now hand over to the Economy Secretary to say a few words before handing over to Professor Leitch.
As the First Minister has said, we are dealing with the significant economic effects from the continuing health crisis. The scale of the challenge ahead is substantial, and we do not underestimate the scale of the impacts on GDP and unemployment. And we recognise the effects on our communities and especially on our society's most vulnerable people. The impact of the COVID-19 pandemic has had a big impact on Scotland's economy, demonstrated by the figures released yesterday that around 628,000 Scottish jobs have been furloughed and a further 146,000 are using the Self-Employment Income Support Scheme. We welcome the support of the Job Retention Scheme and what it is given to employers and their employees, and the scheme's extension to October. But as other countries have done, the UK must look at continuing the scheme in some form to deliver a firm foundation of keeping people in work as a better option than funding mass unemployment. If the UK government continues to reduce support, it is important that there is continuing recognition that public health guidance is devolved, and so progress in easing the lockdown may be different in each nation. The Scottish Government is doing everything we can to respond to the economic impact of COVID. We've developed a package of measures that reflects that Scotland's economy is different to the rest of the UK and continue to support Scotland's businesses by passing on every penny we receive from the UK Government for this purpose and more directly to businesses. This additional investment means that our package for businesses support, including the unique to Scotland Creative Tourism and Hospitality Hardship Fund and the Pivotal Resilience Fund, now totals over £2.3 billion. We have formed an advisory group on economic recovery to provide independent and expert advice on our response to the long-term impacts of coronavirus. The group will report its recommendations this month, and these recommendations will inform the approach to setting the course and direction of Scotland's economic recovery. We are forming a cross-party forum to create an opportunity for representatives of each party in the Scottish Parliament to engage, build consensus and work collectively to mitigate economic damage and focus on economic recovery. And we are doing everything we can to support the Scottish economy. This morning, we announced that town centres will benefit from £2 million of funding to support the recovery of local communities as coronavirus measures are gradually and carefully eased. The Towns and Business Improvement Districts Resilience and Recovery Fund is open to local authorities as well as community and development trusts, chambers of commerce and town centre partnerships to address immediate concerns. In addition to this, as the First Minister has just announced, the multi-million pound Energy Transition Fund will support inclusive and sustainable economic growth and will contribute to climate change commitments, underpinning the regions of the North East's ambitions to become a world leader in the transition to a zero-carbon future, helping Scotland meet its ambitious targets on climate change. This funding will support businesses in the oil, gas and energy sectors over the next 5 years as they grow and diversify into low-carbon and renewable sectors. A number of projects will be considered for funding, including a global underwater hub, net zero solution centre projects, a hydrogen hub and an energy transition zone. We hope that this will attract private sector funding of hundreds of millions of pounds across the projects. The investment will also benefit the wider Scottish energy sector and broader supply chain, working with local businesses to maximise the economic benefits, support sustainable jobs and contribute to inclusive economic growth across the country. And lastly, today I'd like to announce a funding package for the Edinburgh Fringe Festival Society to enable its return next year. This has been an extremely worrying time for people whose livelihoods, careers and well-being have been affected by COVID-19 and the cancellation of festivals such as the Fringe. As part of a commitment to support cultural, social and economic recovery, the festival will receive a £1 million interest-free loan from the Scottish Government. It will also benefit from £149,000 from the Pivotal Enterprise Resilience Fund and a £100,000 grant from the City of Edinburgh Council. The money will be used to mitigate the significant losses incurred as the result of the cancellation of this year's festival due to coronavirus and to invest in future years of the Fringe. As we know, the Fringe is one of Scotland's greatest cultural exports, and this funding package will help ensure the world-renowned festival can bounce back in 2021.
Many thanks, Fiona. I'll hand over briefly now to Professor Leitch before moving on to questions.
Thank you, First Minister. We're starting to think about how Scotland will be coming out of lockdown over the coming weeks, and that is an anxious time for many. Many of us have begun to get used to the safety of staying home and keeping away from public spaces to reduce our chances, rightly, of catching coronavirus. As we start to open up more, everybody will be wanting information about how to protect themselves. But there is a great deal of wrong information out there, so much so that the World Health Organization have invented a new word for it. They've called it the infodemic. This misinformation creates confusion and damages countries' public health responses. So today I'd like to briefly debunk some of those myths and then point you to places where perhaps you can get more reliable information. Firstly, you cannot prevent yourself from catching COVID-19 by exposing yourself to sun or high temperatures. You can catch the virus no matter how sunny or hot the weather is. Many countries with hotter weather than ours are struggling with large numbers of cases. So please don't think that just because summer is approaching that you can do other things. Secondly, vaccines against pneumonia, such as many of you receive for influenza type B, they do not protect you against COVID-19. This virus is so new and different that it needs its own vaccine. And as you know, researchers around the world, including in our own country, are working very, very hard to do that. Thirdly, and finally, there are no specific medicines for COVID-19. There are specific treatments under investigation, and those of you following the news will have noticed that one of them was withdrawn just this week as those trials reach conclusions. These will be tested through clinical trials and, of course, released as soon as they are safe to do so and known that they help. Remember that if you have developed symptoms in the last 7 days, please stay at home for 7 days from the start of your symptoms and arrange to be tested immediately at nhsinform.scot. Please remember, if you or a member of your family have anything else that's worrying you about your health, GP practices are open and NHS 24 is open out of hours. So if you're looking for good, correct information about how to protect yourself and others from coronavirus, both now and as we move through the following weeks, the best place to look is nhsinform.scot/coronavirus. You could, of course, watch these briefings. The other place is if you're a young person, then Young Scot has loads of information for you and for kids. And if you're a parent, finally, parentclub.scot. Thank you, First Minister.
Many thanks, Jason. I'll move now straight to questions. First question today is Sarah Smith from BBC.
Thank you, First Minister. I listened carefully to what you had to say about testing of care home staff in Parliament on Wednesday and at the briefing yesterday. And I understand you were saying you want the testing programme to be sound and sustainable and repeated every week. What I don't quite understand is what's gone wrong. Why is the commitment to test all care home staff not been met, even though it's over 3 weeks since it was first made? And when will that promise be fulfilled?
I've set out this at length in various briefings and on various occasions, but I'm happy to do so for you again today. It does take time to put in place a programme of testing that number of people in place, and health boards have been doing that. The Health Secretary and I have, I think, given a fairly direct indication over the last week or so that we think that progress should be accelerating, and that's why the Health Secretary has made that very clear to health boards. On the other side of that is that we've made clear to health boards that the Scottish Government is there if they need additional resources and support. So that programme is accelerating, and over the next few weeks that will not only complete in terms of the first testing of those that are being tested as part of the programme, but put in place the systems to ensure that that is ongoing and repeat testing, which it will require to do for some time. In addition to that, of course, as I've said before, and people who've been listening before will have heard, is that we are also looking at extending routine testing to other groups. We have a nosocomial expert group looking at the case for more routinely testing NHS workers, not just workers in care homes, and we will receive that advice hopefully shortly. So this will be an ongoing process, but it is also likely to be an expanding process. And with anything of this scale, while that can be frustrating for me and the Health Secretary and for others, it takes time to make sure it is there robustly and on a sound footing that we can build on in the future. Gordon Cree from STV.
Thank you. Can I ask Fiona Hyslop and Jason Leitch about social distancing, the 2-metre rule or guidance? We're hearing a lot of voices from business, particularly the hospitality sector, who would like to see that reduced. I just wonder what discussions have been had with business and indeed within government about this, and whether there are some voices in government who would be minded to go quicker on that one.
Hand over to Fiona, and then Jason. I had personal discussions yesterday with the Scottish Tourism Alliance about that, amongst other things.
And I had discussions with the Scottish Retail Consortium this week on this and other issues. For us to have a strong recovery, for us to be able to get through this difficult period, we need to make sure that that recovery is sustainable, and we need to make sure it's got a strong foundation. So we are being careful. We are listening to the expert advisors, because that's what we do as a government. But we also have to listen to other voices, and that's why we engage with them. I know the hospitality and tourism sector were very pleased to see that conditionally they would be able to restart on the 15th of July. But if we're all going to come through this together, we need to take a responsible approach. And that is why, understanding the pressures that we have, the businesses have, if they want to have long-term sustainability, we need to make sure that those foundations are firm. And that means suppressing the virus. And suppressing the virus in phase one, where we still are, will help the economy. And that's really important, that what we do now will help that economic recovery as we progress.
There is no magic distance that removes all risk from this virus. The WHO say that you should consider at least a metre to begin to think about what you want to do for that phase of the pandemic you're in at that moment. All of our advisory groups that feed into the First Minister and the Cabinet to make these decisions are presently suggesting that 2 metres is the correct distance for this phase of Scotland's pandemic. Now, you could replace the 2 metre physical distancing question with lots of our other elements that we're putting in place about getting people to stay at home as much as they can. So there will, over time, be changes in what we advise and change to the judgments that are then made. Presently, with the present phase of the pandemic, people agree inside the scientific community who are advising the government that 2 metres is the correct distance to have for this point.
Okay. I would just end by, I suppose, saying to people who might be watching, who think that we should reduce the 2 metres to 1 metre now, given the strength of the economic argument that many are making, just consider that if we didn't think it had a risk associated with it, then why wouldn't we just agree to do it? Because there is no interest in the government in making life more difficult for businesses than it already has to be. So the fact that we are not immediately taking that decision suggests that we must judge that there is a significant risk associated with it. And as Jason has set out, these are not absolutes. There are trade-offs and balances that you have to strike, and there is no absolutely risk-free distance. 3 or 4 metres would be less risky than 2 metres, and 2 metres is less risky than 1 metre. And if you go to a shorter distance, face coverings and other mitigations might be necessary. So we've got to get these balances right. We also know that some of the settings where there may be the greatest economic and practical benefit from going to 1 metre are also the kind of settings where the risks of transmission are greater. So in crowded places where you might have to shout over noise to make yourself heard, that's when the way you breathe can make it more risky. So these are difficult judgments that we don't close our minds to, and there's no sort of ideological position in the government here that says we're going to stick to 2 metres come what may. This is all about getting the right balance into our decision making so that we continue to suppress this virus. And here's the key point. The more we can suppress this virus to get as close as possible to effectively eradicating it domestically, and then of course we've got to think about how we stop it coming back into the country and control it when it does. But the more we can get to that point of effective eradication, the more these debates become easier, because we can restore greater normality to every aspect of our lives. But that focus on making sure that we do more to suppress it is the vital foundation that we have to build. David Henderson from BBC Scotland.
Thank you, First Minister. With the UK economy shrinking in April by over 20%, Scotland could be facing a recession as bad as anything in living memory. Now, the Energy Transition Fund you've just announced at £62 million is only about a tenth of 1% of the Scottish budget you control, which is more than £49 billion. Do you have a recovery plan that's equal to the challenge that's now faced by millions of Scots?
Well, that is our challenge and our job. I'll hand over to Fiona in a second, but of course what we've announced today is important. It is not the totality of the economic support that we will require to make available. We have invested already $2.3 billion in immediate support mechanisms for business. Our Cabinet subcommittee this morning talked about the work we will require to do to support employability and skills to try to make sure that we are not seeing unemployment, particularly amongst young people, run out of control. And of course, we have the Economic Recovery Group that will publish its report within the next week or so, setting out a series of recommendations for us. That's what the Scottish Government has to do, and we will continue to focus very hard on that. But given where many of the economic levers lie, this is just a statement of fact, it's not a political point, we need to encourage and persuade the UK Government to take action too. And the key thing that I want to impress upon them right now is the importance of not having cliff edges in the job retention scheme and the wage subsidy, because that has the impact potentially of either forcing businesses to open before it is safe to do so, or to make people redundant. So just like France and other countries are doing, there is a real need to extend that support so that we can continue to take a careful route out of this crisis and get to a point where we have a sustainable economic recovery. Speed is important, but sustainability is what matters most if we're to build that recovery for the long term. Fiona.
Well, this announcement today of £62 million for that Energy Transition Fund is important. It is part of our development of that green recovery that we've said we want to see achieved. We look forward to the recommendations from Benny Higgins' Economic Advisory Group. As the First Minister said, they will be reporting imminently. We are also looking at all the resources the Scottish Government has and how can we refocus them to ensure that we can deliver that sustainable economic recovery and, importantly, as we discussed today, tackle those issues about employment and skills. We do not want to have a situation that our young people faced in the 1980s. We want to make sure that we give them opportunities, that we look to the industries of the future to make sure we can create jobs there and to work with all of Scotland. This economic crisis hasn't just affected one sector as previous recessions have done in the past. This will have an impact on everybody. And if you look at the OECD report, it's also having an impact globally. It's not just Scotland, it's not just the UK. But we can be sensible in what we're doing and we can shape that new future. And if we all come together, employers, our training providers, and indeed all those that are involved in providing those jobs for the future, then we can try and get through and mitigate what will be a very difficult period. And it's not just for the short term, as we understand from those economic reports. We expect that to certainly go in for the next few years.
Thanks, Fiona. Phil McDonald from Global.
Thanks, First Minister. Can I ask how many contact tracers in Scotland are actually furloughed from other jobs, and what will happen when they start to return to their normal work? Are there plans in place to essentially close gaps in the test and protect system as the economy starts to reopen?
So I don't have a particular figure for you on the furlough point. If there are any, and we can get you that figure, we will do so later. But I've explained this before, but what we did in the initial set-up phase of Test and Protect to make sure we had the pool of 2,000. In fact, we got slightly more than 2,000 at the kick-off date of the 28th of May, although not all of them have been required so far, is that these roles were largely reallocated within the NHS. But we also, as you are aware, had a recruitment programme and thousands of people have applied for posts as contact tracers, and there is a process underway of interview and offers of employment to these people. So progressively over the next weeks and months, those who have been, perhaps not everybody, but some who have been reallocated from other NHS roles will be replaced by people who have been employed. But throughout all of this, we will have the required number of contact tracers that we need to do the vital job that Test and Protect is doing. Want to add anything?
Only that in the remobilisation plans we have taken into account COVID-19 related activity. So we will need to keep ward space available, and we will need to keep Test and Protect robust and available. And the First Minister is correct. The local delivery of Test and Protect in Scotland has been crucial. We have local leadership from the Directors of Public Health in each of the health boards responsible for their staffing levels and their individual Test and Protect process linked to that national process. So I hear nothing from any of them that suggests the test and protect contact tracers is remotely fragile.
Thank you. Neil Purin from PA.
Thanks, First Minister. In terms of the job retention scheme, how long exactly would you like to see this extended for? And if it does have to come to an end at some point, what other forms of wage subsidy would you like to see introduced? And how much can realistically be achieved, given how much has been spent on it already?
So let me make a couple of general points, and then Fiona may want to add as well. So I think this is a discussion we want to have with the UK government. I think there's a point in principle that we would like to seek agreement on, which is there cannot be a premature end to this. But what form it takes going forward, for how long that will be required, and whether it is a general extension or one that is perhaps in time more focused on particular sectors that will take longer to recover, I think is a discussion that we're very keen to have in detail. If you take the French announcement earlier this week, I think, and obviously I'm sure be more detail yet to be developed there as well. They have said that they are prepared for some kind of scheme like this being in place for potentially up to 2 years. So I think we need to give longer term certainty. Now, of course, we all hope that scientific developments will get us to a resolution of coronavirus quicker than that, but we need to have that certainty in place. The other thing, I suppose, about, because obviously the UK government has committed a significant amount of money, rightly so, and they deserve credit for that, and we've openly given them that credit. But if that is withdrawn prematurely and we end up with people avoidably becoming unemployed, then it's not the case that there is no cost to the government from that. The cost just falls on the government in different ways. So trying to invest public money to keep people in employment, to protect the productive capacity of the economy, seems to me to be more sensible than paying for the costs of unemployment and economic devastation. Fiona.
Well, clearly the UK government, in terms of its macro and fiscal levers, have managed to produce a scheme which is significant, and we are very grateful for that. They do have the borrowing powers that allows them to have such programmes of such scale. We'll talk to them about timescales. Clearly they are already open for change, because the original job retention scheme was meant to end in August and it was extended to October. And we've seen not just global demand collapse, but also local demand. And many companies that are restarting, that flexibility they have is welcome, but that they're not necessarily going to be able to achieve the same levels of activity that they did pre the lockdown. So therefore, easing that through is really important to sustain the economy, to keep people in jobs. And yes, we know there are particular sectors that won't be able to reopen for a significant amount of time, those involved in the event sector. And we also know that some of the oil and gas companies, for other reasons as well, will be longer term in coming back. So it makes sense for them to have flexibility, to reconsider where they are, but also to be open to ideas. And our suggestion is that for the longer term, it would be better to keep people in jobs than to have companies having to have redundancies when perhaps potentially, had they been supported for a bit longer, when demand came back, both nationally and within Scotland, within the UK, and also globally, they could return in a stronger position.
Thanks. Libby Brooks from The Guardian. Oh, so I'm being told Libby is not with us. Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Just back on the 2 metre rule, you've previously said that you'd be open to relaxing that if the scientific advice supported it. But on Twitter, you said this morning, if we can effectively eradicate COVID, decisions then, e.g. 2 metres versus 1 metre, are more possible. But first, we must suppress/eradicate. And you also used the term effective eradication in response to Gordon earlier. So we've had Andrew Wilson, among others, have been raising the concerns of businesses that lockdown is being eased too slowly. So what would you say to businesses who would say that effective eradication is too high a bar for easing considering changing the 2 metre rule? And also to Professor Leitch, what would be a realistic time frame for effective eradication? Could that be done if test and protect is a big success, or would it need a cure or a vaccine? Thank you.
I understand why people are lobbying us to take action on different fronts. I have no criticism of that. People are deeply anxious about the economic impact, and that is an anxiety that I share. But I have to take account not of just one aspect or other of this crisis and how we handle it. I have to take account of the overall handling, because if we get the balance of our response wrong here, we will take ourselves backwards, and that will do even deeper damage to the economy. So, you know, I do think anybody who tries to suggest that any of these issues is really straightforward or simple is doing a disservice to the overall challenge that we face. It is simply not the case that you could go from 2 metres to 1 metre with no consequence and it's straightforward. It's not straightforward. There are a lot of really difficult issues that have to be balanced there, and no, if very few, if any, aspects of this can be seen in isolation. On the eradication point, we are making really, really good progress right now in suppressing this virus. Our case numbers are falling rapidly, those in hospital falling, ICU, our death numbers, thankfully, are falling rapidly. We now have an R number that might, where a few weeks ago it might have been slightly higher than the rest of the UK, we think it might be slightly lower. That is because we are following a careful and a cautious plan. And if the lesson we take from that is to just throw that plan away and move too quickly, we will regret that within a very short space of time. So the lesson I'm taking from it is stick with it, because if we get to a lower level of suppression, now people talk about eradication, our biggest limitation in doing what New Zealand have done, for example, which is effectively eradicate, is that in Scotland right now, the Scottish Government, we don't have the same powers to effectively close our borders to stop importation. Not that I would ever relish the prospect of closing borders, but even for a short period of time. But we can use test and protect if we get it to a low enough level to just deal with sporadic outbreaks. And that then means that we can introduce more normality back into our day-to-day lives. So we are getting very close to a level where we have suppressed it very, very, very far. And if we stick with things for just a little bit longer, then some of the conversations we will be having in the medium term will not become easy, but they will become easier. The worst thing we could do right now is take a lesson from the success we're having that says just chuck the plan away and accelerate everything and, you know, forget about the 2 metre rule and just go back to normal really quickly. I'd be standing here in a few weeks' time reporting figures to you that you would rightly be telling me, why on earth did you do that when we were so close to actually suppressing this to the levels we need to do it? So I know how difficult this is, but having come this far, we have to stick with it to get to where we need to be. Jason.
Remember, the country lives with infectious disease all the time. The difference here is that this is a novel coronavirus that has had deathly consequences over our population, particularly our elderly and comorbidity populations. So we have to be extremely cautious. But the clinical advice will follow exactly what the First Minister has just said. Once we are confident that we are only seeing smaller contained outbreaks, then the clinical advice will be able to change, and then judgments will be made about where we are in the route map and what should open up. Our fear is that a second wave comes now or in the winter, and we have to give advice that says we've gone too early. So that would be worse for the economy and the sections of industry that Ms Hyslop and the First Minister have both talked about. And we really, really want to avoid that. That doesn't mean we're not keen to move. It's not the public health professionals on one side of this argument and the politicians on the other. That is not how it is working. So we live with norovirus, we live with influenza, we live with the common cold all the time. So once we get to a level where either we have treatment, vaccine, or the numbers are so low that we're just having sporadic outbreaks, then the clinical advice will change.
One final point from me on this, because we are learning more about this novel coronavirus every week that passes right now. And some of what we are learning is about where the risks of transmission is greater, and over time that may mean that we can target some of our measures, as in particular as we get down to having more sporadic outbreaks. But unfortunately, some of what we're learning about this virus necessitates even more the caution that I've been expressing, because we talk a lot, understandably, about the numbers of people who are dying, but one of the things that we are starting to learn is that even in people who do not die from this virus, some of them may be left with long-term health consequences of it. It's a horrible illness that does real damage to some people, even to those who survive it. So all of that says we cannot play fast and loose with it. And, you know, I seem to, some days, many of the questions I get at this briefing is, why didn't you do things earlier? And now, of course, the questions on other days are, why are you taking longer to do things? This is all a really difficult balance to strike, but we've got to strike it with the preservation of health and life absolutely at the forefront of our minds. And if we do that, then we build a better foundation for economic recovery. The two things are not in competition. They absolutely go hand in hand. Christine Lavelle from The Sun.
Thank you, First Minister. My question's for Professor Leitch. In your opening remarks, you sought to debunk some of the myths surrounding the virus. I just wondered, is there a reason or something that's concerning you about the public's attitudes or behaviour that's prompted you to correct those myths today?
Or maybe it's concerns about how the media sometimes report it that prompt some of those concerns, but I'm not going to put words into Jason's mouth.
I couldn't possibly comment about the nature of the media reporting. Nothing specific in the last 24 hours, but I do watch social media and have had an increased interest in the printed media and the broadcast media. And I do see some of those myths getting traction, principally amongst individuals in the social media space, if I'm honest. And I just want, the examples I gave were just simply to give examples of what we might call fake news. The principle, though, I think is really important. And the WHO have genuinely put out information about how to help with mental health, how to help with infection control, what to do with face coverings, and what to do about the information that you take in for the pandemic. I think it's a crucial element of our response. You may disagree, but I think our communication has been very upfront. It's been very vocal, both here and in the media and in the radio stations around the country. I never thought the First Minister and I would be on the chart shows of Scotland trying to talk to a different audience about what they should do. So we very deliberately used all of those messaging routes to try and get the correct message out to the population of Scotland.
Thank you. I'm not sure I have been on the chart shows of Scotland.
Yeah,
I'm not even sure I know what they are, but
you
anyway,
were.
you learn something new. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. I'd like to ask you about DNA CPRs and the current policy in hospitals. The Health Secretary told us some time ago that they should not be enforced without full discussion with family and/or the patient. However, I understand in at least one Scots hospital that's not the case. A nurse's own mother was taken into hospital 3 weeks ago, and only when she was discharged did the family discover the DNA CPR had been enforced when the nurse found it in an alginate bag along with her mum's soiled clothing. Attempts had been made to contact the patient's son on the first day of admission, but when they failed to do so, the form was filled in anyway, and no further attempt was made to contact the family. The daughter believes the ban on families visiting patients because of COVID rules is allowing the NHS, in her words, to play God. Her mum wasn't a COVID patient. I passed fuller details to your office this morning, First Minister, of this particular case. But what are the DNR rules in our hospitals at the moment?
Can I say, I'm going to pass to Jason Leitch because we have an awareness of this particular case, and I understand the Scottish Government has already spoken to the Health Board in question about it, and Jason can say a bit more. But what we've said previously about do not resuscitate instructions is that nobody should be put under pressure to sign one of these or agree one of these, and nobody should find themselves signing it without proper discussion as part of an overall anticipatory care plan, and the Chief Medical Officer set that out at briefings before, and I'm sure Jason will as well. What you have described there is completely unacceptable. Obviously, I only know what I've been told about that, but I've no reason, of course, to doubt anything that the family is saying, but that would not be an acceptable practice. But I'll hand over to Jason because, as I say, I understand there has been some communication with the Health Board concerned.
We do know a little of this story, and thank you for raising it. What I have read in the newspaper is entirely unacceptable. Greater Glasgow and Clyde Health Board have apologised to the family, I understand, yesterday or today, and they have reached out to the family to engage with them around both hearing their side of the story and putting it right. So I'm pleased that Greater Glasgow and Clyde have done that. On the general points, let me be very clear about what the rules are in Scotland. Visiting is not banned. Visiting is allowed for certain safe elements of our care. So end-of-life care, those who would be distressed without visiting, and a few other exceptions like birth partners. COVID-19 has brought no change to our DNA CPR guidelines, none. So every single one of those conversations should be done compassionately, should be done with patient and care team and family if the patient wishes that, and that should just be as it has always been. These conversations are often very challenging. They're often I've done them. They're really often difficult, but if you approach them from both sides compassionately, they are often hugely helpful for families. And the third part of this story, which you haven't mentioned, Vivian, but also comes out in the story, is about the discharge of this lady back to home. And I just wanted to make clear that discharge decisions are clinical decisions. They're not managerial decisions. They are made with three parties: the care team of the hospital, the care team of social care receiving the patient, and the patient and the family. If those three groups haven't had a conversation, then that discharge should not happen. It should be all three of them together deciding what's in the best interests of that particular patient. And it would appear from reading the newspaper article that perhaps that didn't happen in the way I would expect it to happen. So I'm glad Greater Glasgow and Clyde are looking into it and correcting it.
Okay, thank you, and thank you for both raising it today and sending us fuller details earlier. Derek Healy from the Courier.
First Minister, I wanted to ask you about the GDP figures out today. You've said before that you're comfortable with Scotland coming out of lockdown at a slower pace than other parts of the UK, if that's necessary. If Scotland does stay in lockdown for longer, could that make the economic situation here worse than other parts of the UK? And I appreciate there's a delicate balancing act in terms of harms, but how does a financial crisis on this kind of scale impact your decision-making in terms of easing lockdown?
Well, just firstly, in terms of differences between different parts of the UK, it's really important that we take these decisions based on our own evidence and advice for the areas and countries we're responsible for. But, you know, we are looking at differences of, a few weeks between things happening. And as long as things continue in the right direction, hopefully that is what it will be at most. But also what I would say is, it comes back to a point I made earlier on. I think we will do our economy more good if we build a sustainable recovery. If we go for more speed at the price of that sustainability, the damage that is done to our economy is likely to be deeper and it will last longer. And so that, in a sense, is why I think it is really important to go at the right pace here, because if we were to allow a sector of the economy to open up a week before we thought it was safe, or 2 weeks before we thought it was safe, given the data on the virus, then they might be pleased about that in the short term. But if the price of that is the virus running out of control again, then they may end up having restrictions on their ability to operate for longer. So, you know, none of this is an absolute science, unfortunately. I really wish it was, but it is about taking the most careful judgments so that we, yes, get the economy moving as quickly as possible, but more importantly, we get it moving sustainably so that it keeps going in the forward direction and that we don't have to go back the way. And that's the balance we're seeking to strike. Fiona, do you want to?
Just briefly, we have to look at this in context. Each country has eased out of the lockdown differently because of their own experiences, and the issue between Scotland and the rest of the UK, as the First Minister said, currently is just a matter of weeks. I think what is more significant for the differences in terms of our economic response and indeed the impact is the character of Scotland's economy. So tourism is far more important to Scotland's economy than it is for the rest of the UK. Oil and gas has more significance. So therefore, downturns in those two sectors in and of themselves will have an impact, which is also why the response, the economic response, both from the Scottish Government, and we've had some of that in the announcement today and this week, but also from the UK Government, will have to reflect those differences as well.
Scott McNabb from the Scotsman.
Thank you, First Minister. The £62 million Energy Transition Fund announced today focuses on the shift to net zero and meeting climate change targets. But can I ask, is future exploration and extraction of new oil and gas fields still seen as a key part of the future of the North Sea? Industry leaders would presumably say this is integral to their immediate business planning.
Well, our focus is very much on the transition to renewables. Oil and gas is a big part to play in that, as I've said in the past, and we'll say again. We need the continued contribution at this stage of our oil and gas industry, even from an energy perspective, because if we don't have that, then we become more reliant on imports, which is not good for our carbon footprint either. But we are very clearly in the transition to renewables, and that's what this fund is very much focused on. Do you want to say more about it? Okay. David Ball from the Herald.
Thank you, First Minister. With the tourism and hospitality sector planning on reopening next month, are you at all concerned about an influx in visitors to rural parts of the country who maybe don't have the healthcare capacity to deal with a second surge, given the virus will still be with us? And would you expect sort of local authorities and even the Forestry Commission to reopen facilities, given the importance of hygiene?
Well, look, we have to take these decisions step by step, and it comes back to this real importance of being methodical and following a plan. So we are right now in the process of assessing changes that we might make next week as we get to hopefully phase 3 into July. We will consider the steps that we might take then. Right now, the advice to people is not to travel more than 5 miles for leisure or recreation, because we don't want people moving from different parts of one part of the country to another and potentially taking the virus with them, and we don't want to put pressure on infrastructure in our more rural areas. But as we go through the next phases, of course, we want to ease that as well, but we have to do that based on the careful considerations that are underway. And as I said yesterday, and I've said it again today, I understand and actually in many respects share the desire just to go much more quickly back to normality. But getting the pace and the sequencing of this right is so important, so that when we get to a point where we have restored normality, or as much of it as we can, we are doing that sustainably, and we're not worrying about going backwards. So we need to keep doing this in a careful and planned way. Michael Blackley from the Daily Mail.
Hello, good afternoon. You've said today that the virus needs to be suppressed in order to be able to consider cutting the 2-metre social distancing rule. The Scottish Government's route map for exiting lockdown sets out that in phase 3, the virus would need to be suppressed in order to enter phase 3. So is it fair to say then that there's a chance that if we are fit to enter phase 3, we are fit to reduce the social distancing rule? And it's fairly crucial for hospitality firms who are deciding whether to prepare to open next month or not. So is that what they should be thinking at this moment?
Look, I've already said quite a lot today about the 2-metre rule and about the phasing we've got to take. So I'm going to try not to repeat all of it. What I would say, though, is these have to be balanced decisions. I fully understand why, if you're a business where the difference between operating profitably and not is the 2-metre rule, then that is your entire focus. I make no criticism of you for that. I absolutely understand it. And I understand if you're a business in another area where encouraging people to travel more is your focus, that's the bit of advice you want us to change. My job, and it's what you elect me to do, is to see the whole picture and to make sure that we are making balanced judgments that take us safely through this in an overall way. And that's why, while I understand it and don't criticise it, if we try to focus all of the discussion and oversimplify the discussions around particular aspects of this, we miss this bigger picture. And it's the overall recovery from this, the overall move out of a crisis situation into a stage where the virus is posing less of a risk to us, that allows all businesses to hopefully move back more quickly. So we need to keep taking these decisions in a balanced way, taking account of all of this. I don't have the luxury in making these decisions of just focusing on one aspect of it. I have to look at it all. I have to look at the 2 metre rule, the travel distance rule. I have to look at the health impacts of the decisions we take and the economic impacts, and try to come to the best balanced way forward that keeps fundamentally people safe, which is probably my most important duty, but also allows the economy to get back into operation sustainably. And I keep using that word sustainably because that's what matters here. It's, you know, if we get the economy opened a couple of weeks earlier than we should, we'll find we're closing it down again before too long. So it's about getting it open at a pace and in a way that allows it to stay open. And that's why suppressing the virus more than we have even now continues to be so important. Adele Merson from the Evening Express.
Good afternoon, First Minister. You made passing reference to the Aberdeen Harbour expansion project in your opening remarks. I know it was announced this week that the main contractor, Dragados, has pulled out of the project, which has been impacted as a result of the COVID-19 crisis, leaving nearly 1/3 of the work undone. Does the Scottish Government remain committed to this project, and do you plan to offer assistance to the Harbour Board to assist them with delivery?
We remain committed and we'll do whatever we can. I'll hand over to Fiona.
Yes, the Aberdeen Harbour expansion is really important as part of that infrastructure response for the North East. Obviously, there's concern about what's happened, but we absolutely stand by our support for the Aberdeen Harbour expansion. And I hope that the announcements we've made today gives confidence to all of those that are involved in the work around that. And I know it's a challenge just now, but I'm sure they can achieve another contractor in terms of doing that work. But I think that vote of confidence that we've given today in the North East should also help support Aberdeen Harbour expansion in their project work continuing, and to make sure that the investments, not just from the public sector, but also from the private sector, is given that steer about how important we see this and the opportunities that that expansion will bring to Aberdeen and the North East.
And the last question today, Kenny McBride from Broadcasting Scotland.
Thank you, First Minister. Broadcasting Scotland is going to be discussing universal basic income on a special show tonight. So in light of the feasibility study that's just been published, could you speak a little bit, please, about the Scottish Government's efforts to, first of all, press the case for an emergency basic income during the pandemic, and also what progress has been made in discussions with the UK Government on how to facilitate a pilot in Scotland? And also, if the Economy Secretary has any comments on the macroeconomic issues, then I'd love to hear those too. Thank you.
Okay, very briefly from me, because it's an issue I've covered before, and I'm sure I'll talk about it more in the weeks and months to come. We supported some exploratory work into universal basic income. At that point, we were very keen on exploring the concept and seeing whether the argument could be made. I've moved, I think, as a result of this crisis, from a position of being interested in it to being very supportive of the concept of a universal basic income, and we want to seek to move forward as we come out of the COVID crisis period. Again, I just say this as a statement of fact. The power split between Holyrood and Westminster means that Holyrood could not unilaterally completely do a universal basic income, because tax and welfare powers still lie largely with Westminster. So we need to, in the short term anyway, have a discussion with the UK Government, and we'll seek to progress that in the period ahead. Of course, we still remain focused on the immediate crisis, but that's an issue, as well as with wider recovery issues, that we want to have constructive discussions about. Fiona.
I can add that Aileen Campbell, the Community Secretary, has written to the UK Government setting out the experience from the feasibility study that has been recently published, and she's seeking to have engagement with the UK Government as to how Scotland can progress this very, very important idea. You talked about the macro powers that the UK Government has. Of course, they're very similar to other countries across the world, and you can see what the economic response from other countries are that demonstrate where the UK sits within that. You've seen the UK borrowing the equivalent of a whole year's worth of funding in 1 month last month, and that shows the scale of what those powers can be to help deliver some of those bigger schemes. We can't do that currently where we are. And certainly immediately in some of the immediate issues, though, we do need to make sure that the UK Government look at what we can do within the devolved settlement to make sure we've got a responsiveness. And my colleague Kate Forbes will be giving evidence to the Finance Committee this afternoon on these very matters. But we are limited because of our powers, but that doesn't mean we are powerless, and that is why we're determined to make sure that the economic response and the reset and the restart and the recovery in Scotland is strong and sustainable.
Thanks, Fiona. That brings us to the end of today's update. My thanks to Fiona and to Jason for joining me today. My thanks to Rachel, our BSL interpreter, and thank you to all of you. I'm very aware that we do stand at a very critical juncture, and I know that as we see the numbers all thankfully go in the right direction, and as our anxiety about the economy increases, there is inevitably a growing impatience and frustration for us to get back to normal. And please know that I share that. I feel that as much as all of you do. But I also know that we are making the progress we are making now because of the plan that we're following, not in spite of it. So the one thing that would risk that progress is throwing that plan away and starting to act in a way that wasn't as thought out and carefully considered. So we are making real progress, and everybody should feel a degree of optimism about that. And if we stick with it, we'll see it continue, and we will enable us all to get back to some kind of normality. So my thanks to you for sticking with it, and I hope you have as good a weekend as you're able to do in these circumstances. I will be back here with you on Sunday for the weekend briefing at the later time of 2:30, I think. So I will see you all then, and in the meantime, thanks for joining us today.